The EMHP programme is really unique in the sense that it's quite similar to the CWP programme, but trainees on this programme are predominantly based in schools. Even though they're employed by children and young people mental health services, they're then sent out to deliver interventions in schools.
We're an excellent, world-class university, and the course that's delivered by Lily as director is a fantastic course. We've had really positive feedback. We're based in North London at the Anna Freud Centre, which is a beautiful building to work in and to study, and our placements are in North London sites and in Essex sites for the next waves that we have.
As an EMHP trainee, you would be teaching 2 or 3 days a week at university, and then on your other days you will be attending your service where you're based, and they will be sending you out to schools. Although it's a training programme and you are enrolled at university, it's also a full-time job, so you are employed 5 days a week and have an annual salary. It just so happens that you're being paid to also train. So something to keep in mind is that there is a lot demanded of you, both academically and professionally, and you have to be able to juggle those two aspects at all times. But saying that, it's a really good experience, and it's great to learn practically, and if that suits you, then this programme would be right for you.
I decided to apply because I thought it would be the best way for me to kind of put into practice my knowledge about psychology and my experience within education. It's a big commitment, so you're learning lots of new information and there's lots that you need to put into practice. So definitely make sure it's the right role for you and that you're ready to be committed and enthusiastic about the programme, because there's a lot of potential to make big differences to people's lives.
My experience doing the EMHP training course so far has been really positive. I've met lots of really good people. It's always nice to come to the Anna Freud Centre and be surrounded by people who are really impassioned by helping young people. We've done lots of really inspiring lectures with some of the top clinicians at the Anna Freud Centre, teaching us how to deliver groups for helping depression in young people and adolescents. And that's something that I really hope to take forward in my career.
In a year of training, you can experience both UCL as an institution, the Anna Freud Centre, who are pioneers in young people and children's mental health, and then on top of that, your site and the schools that you'll be working in. So in a year, you'd experience quite a lot of different organisations and come away with a quite hefty amount of experience on your CV.
I've definitely learned a lot more about how different places of work can be. Because I'm kind of in 3 different places. I'm in university, I'm in the site, I'm in my site and at school. And they're all such different environments. And I think I've learned to be quite versatile and adjust based on where I'm going.
The skills that you might gain from doing this programme, firstly, to learn to work in different contexts, so educational and health contexts. You'd also be trained to deliver a low-intensity CBT intervention for anxiety, low mood and behavioural difficulties. So you'd be working with children as well as parents. You'd also be running groups in schools predominantly on psychoeducation for young people.
The transferable skills I've learned on the EMHP programme are to be compassionate. That's a really important part of doing the clinical work. Also to organise myself. There's lots more autonomy than I'm used to working in a school, so that's been a challenge, but also really good to learn those organisational skills.
Collaborative working, so learning to work with others and thinking about how you work with young people and families. Communication skills, so making sure that you're able to speak to people properly and communicate effectively with young people and families. When I was actually able to meet a young person and really think about the difference that I was going to be able to make to their life, that was a really big highlight for me, and it reminded me of why I'm doing this. I've learned a lot of new skills, met a lot of new people, and it's just been a fantastic opportunity to really make a difference to people's lives.
If you're interested in a career working with children and young people and with mental health issues, you also have experience already working with children and young people, and whether it's in mental health services or an educational background, I would suggest that this programme would be very appropriate for you and could give you skills and tools to continue in your career and be able to deliver very specific and very needed interventions.